begin with a question about primary care first. In preparation for that, Dr. Mingle, can you remind us what care first is?
Primary Care First is one of the newest additions to the experimental alternative payment models in operation under the Center for Medicare and Medicaid Innovation, the CMMI. PCF, that is Primary Care First, replaces the Comprehensive Primary Care CPC Plus program that ran from January 1st, 2017 through December 31st, 2021. Lessons learned from the CPC Plus program were integrated into the new PCF program, and CPC Plus participating practices were encouraged to roll over into the PCF program. There are about 2,600 practices participating in two cohorts. The first cohort started January 1st of 2021. The second cohort started just a year later, January 1st of 2022. The program is scheduled to end after the 2026 performance year. Practices are sorted into four strata by the average complexity score of the attributed patient panel, as indicated by the average patient hierarchical condition category scores. That's the HCC scores. Payment for Primary Care First participants is a combination of a prospective quarterly professional population-based payment, which is a care management fee tiered to the risk strata of the practice. Then there's a flat visit fee for every primary care visit paid based on the claim submitted. And then there's a performance-based adjustment paid quarterly. Factoring into that quarterly performance-based adjustment are first a total per capita cost measure calculated by Medicare from claims. That's the TPCC measure we've been using for years. There's also an acute hospital utilization measure calculated by Medicare from claims. Medicare uses either one of those depending on the risk tier of the practice. And then there's a set of quality measures, also specific to the risk tier. As with all alternative payment models under the CMMI, there is a quality measure requirement. The specific measures vary by the complexity strata, as measured by that average HCC risk score of the patient panel. For practices in the lower two risk strata, that is levels 1 and 2, it's measure 1, we know well as hemoglobin A1C, measure 236, we know as the controlling high blood pressure measure, measure 113, which is the colorectal cancer screening measure, and advanced care plan. And more about that later. It's not the measure 47 that you were used to from the MIPS menu of measures. And there's also a CAPS survey with a few amendments added specific to primary care first. Measures for the two higher risk strata, levels 3 and 4, are for advanced care plan, the same one as before, the CAPS survey as likewise. There has been a days at home measure that was used in the first 2 years of the program, but it's on hold now for the 2023 performance year, may or may not be reintroduced at a later date.